Hi, this is Eric Durek, and welcome to this edition of Med Health Fit, the show that integrates wellness and healthcare. And tonight we are privileged to have Julia Loggins. She is the owner of julialoggins.com. She is one of the premier holistic health practitioners here in town. You've been here for many years, and you have really established yourself as a premier person. So welcome to the show.
Thank you so much.
And tell us a little bit about the business. How did you get started with this so many years ago when I think that possibly holistic health wasn't as on fire as it is today? There wasn't as much interest, I would say.
Oh, that's true. Well, I got into this business because of saving my own life. I spent a chunk of my first 20 years hospitalized. I was in and out of hospitals. My mom says that my first words were, "My stomach hurts." I had life-threatening asthma, migraines, colitis, all kinds of digestive problems, rheumatoid arthritis. What I had was I was environmentally sensitive, and that's something that in the 60s and 70s was a pretty unknown term.
Right. Where did you grow up in?
Los Angeles,
so you're in
Southern
Los
California.
Angeles area. Okay, so when I grew up in the 60s, it was all about Wheaties and Kellogg's Sugar Frosted
That's
Flakes,
right.
and then later on some of the other wacky cereals. But my dad read Prevention magazine in the 60s and 70s, and he basically told my mom, "I don't want you buying that cereal for them anymore."
Wow.
Which I thought was pretty. The only cereal he allowed us to eat was Wheaties because that's what the athletes had. And I guess it was all right, but it was very interesting. So you've, and I don't want to get too personal, but I think that your health issues probably stemmed from some of the foods you were eating at the time and your sort of allergic reactions to them.
Yeah, and I was a canary in the coal mine. I was allergic to things that were being used in the environment and things that were going on the foods. It wasn't just sugar, wheat, dairy, things like that, but it was also pesticides and environmental toxins.
Right, because LA was such a clean place to be in the 60s, right?
Exactly.
So you took it upon yourself as like a late teenager, early 20s, to sort of, I've got to do something about this.
Well, not really. I was dying. Doctors told my parents I wouldn't live past 17, so I wasn't taking much upon myself other than just getting through the day.
Wow.
But my parents found a medical doctor named Dr. Robert Pottinger, whose family was famous for the Pottinger cat studies, which is a study that proved that with the standard American diet and all the toxins went in it that go along with it, that the cats were infertile in 3 generations. And he understood environmental sensitivities, and when my parents took me to him, he said, "You've just got to get her off not only sugar, wheat, gluten, and dairy." He gave me allergy tests. There was only 5 things that I wasn't allergic to. I'd become what's called a universal reactor because my immune system was so shot. So. And he said, "You've just got to have her on clean, organic foods." That's my prescription, which was unheard of.
Shocking in the day, yeah.
The doctors that they'd been going to were just giving them armloads of drugs. They would give my mom every month, whatever they got in that month, to try to make me better.
And if there's a silver lining to this, you were young,
Yes.
and through years of eating much better, you turn around your immune system.
Yeah.
And can you have a slice of pizza today, or what?
No, now I don't choose to, because now after being in pain and hurting every single day for many, many years, to have vibrant, good health, to have fantastic energy, to have a good mood and my optimism and my joy, it's just not worth trading that.
Right. Well, and I understand that because, when I read about junk food, especially around the holidays now, because holidays is, probably good for your business, I guess, but it's just a cookie. It's just a chocolate. It's here. It's love. They're giving you chocolates and this thing, and we have the chocolate store here, C's Candy. I mean, they got some pretty good stuff, but people, I see everything at work, and it's just,
I'm lucky, when I work with people and they do my cleanses and they eliminate those things from their diet, they feel so extraordinary that it doesn't become like white knuckling it to not eat those things. And there's so many other things that take the place that it just becomes an easier and easier thing to do, to have those diet changes.
Interestingly enough, in the 80s it was heart disease, in the 90s it was diabetes, and in the early 2000s it was behavioral health. And now medicine is sort of looking at inflammatory bowel syndrome and irritable bowel syndrome and leaky gut syndrome and all of these syndromes for essentially the digestive tract. And so they're now trying to get, again, another box load of drugs to actually start looking at these things. Where does your system, and tell me first a little bit about your system and then where it actually fits into this paradigm of the inflammatory bowel syndrome, the leaky gut, etc. And then the third question is, how can you do one better than what's out there now?
Good question. Well, my system is simple, which is it has to do with cleansing and detoxification and nourishment.
Okay.
So what I've discovered, and now gut health is in the window. So the things that I was seeing in my practice 35 years ago when I began wasn't corroborated by science then, but it is now, which is really exciting to me. And
So you're ahead of the curve?
it's thrilling. But what I've discovered is that people are so toxic from the environment we live in.
Yep.
2,500 chemicals a day that we come in contact with. Our bodies, our livers weren't designed to assimilate those or eliminate them. They're stored in our body. That's why we're sick. So cleansing and detox is the place to begin. The doctors I work with even advise, before we start supplementing or even testing, we just do detox and cleansing, and then there's nourishment, and the body heals. The body and the mind heal, since we know the gut and brain are connected.
Absolutely,
Yeah.
absolutely. Well, tell me a little bit about the procedure, not getting into the nitty-gritty details, but is it safe? How effective is it? What kind of health issues? And the reason I ask this is because I read, and I think we spoke about this before we went on the air, I read about 6 months ago about a group of people who were getting sick from having colonoscopies because they were reusing some of the tubes with these patients. And I said to you, they don't have access to an autoclave. They can't throw the. I was shocked to hear. I mean, literally hundreds of people have gotten sick, and that procedure in and of itself can cause tears in the lining of the intestinal tract, etc. So compare that to your system for safety and efficacy and your track record.
Right, and of course what we're talking about is colon hydrotherapy, and a colonic or colon hydrotherapy isn't the same thing as a colonoscopy. A colonoscopy is a diagnostic procedure,
right,
and a colon hydrotherapy is a cleansing procedure. And yes, everything I use is disposable, so nobody's going to have
Everyone gets fresh
everyone
material.
Has their own material. The machine sterilizes itself, so we're dealing with all clean and sterile things. And actually, colon hydrotherapy, it not only is it safe, it was done in hospitals up till the 70s. It was even written about in the Merck Manual, which is the kind of the Bible for physicians. So it's really only been relatively recently that colon hydrotherapy hasn't been a part of traditional medicine. And it is a safe procedure that's used to clean and detox the colon, which is really the gateway to the liver, and that's one of the reasons why we encourage people to clean out their colon. It holds 5 to 30 pounds of waste in it, and when that moves, not only does a person feel a whole lot better, but then their liver can start detoxifying those chemicals we were talking about earlier.
It's interesting now that I'm in my 50s, because when I was up to an adult, when I was about 21, 22, I sort of hit about 160 to 165 pounds, and I stayed there up until about maybe 5 or 6 years ago. And now I hover between 185 and 190. And I have this theory that a lot of guys that my age aren't fat because they have like all this extra fat. It's that it's coming from the inside out, and that they're actually their stomach is going outward because the intestines are getting bigger.
Right, and our intestines are amazing that they can hold what they do. I mean, you've probably heard that, Elvis Presley had, like 40 pounds of waste in his colon when he died. John Wayne had 50 pounds. The fact that our colons can even hold that much to try to save our lives is extraordinary.
Well, the small intestines are 21 feet long, right?
That's the small intestine, and we're talking about the large intestine, right? That's 6 feet long, but it can hold that much waste.
Which is unbelievable.
It's kind of unbelievable.
It's unbelievable. But the body, the human body does some very, very interesting things.
It does.
And we also spoke about other issues with today's medicine and the drug regimes. And there seems to be more drugs on TV now than ever.
There are.
And a lot of these pharmaceutical regimes, pharmaceutical drugs, etc., have a tendency to deplete certain types of the immune system.
Right.
Macrophage, natural killer cells, neutrophils, etc.
Yes.
all have a depleted job function from drugs. And one of the questions that I always ask myself about hydrocolon therapy is, well, when you wash away the intestines, you're flushing this thing, are you not flushing away the good bacteria and the immune cells and everything else when you're doing this? So explain to me how that works.
Yeah, well, actually, 80% of the immune system is located in the gut, and when colonic is actually like a gentle massage and stimulates it. So it's actually very stimulating to the immune system, and it's a good question about, does everything get washed away? And a healthy person regenerates all their gut bacteria in 24 hours. Okay. Otherwise, everybody who ever had the flu would never have any gut bacteria again, right? But it's not that I do recommend probiotics, but a healthy person will remake their own.
Right, and we'll talk about that in a couple minutes, because that's part of the product line that you actually deliver to your client base. Also, I'm going to go back to some of the questions that we spoke about before we went on air. You mentioned the fact in our last conversation that AARP and Kaiser have a program now called Cologuard, in which instead of the whole colonoscopy thing, they actually take a small stool sample and they identify. So tell me a little bit about that.
So Cologuard is now recommended by the AMA and gastroenterologists.
Okay.
And Kaiser Permanente recommends it, and it's a stool sample, and it's, usually they recommend it to be done yearly. It's 99% effective for detecting cancer. And so the only reason that they would do a colonoscopy after that is if there's something that comes up that they want to check out on the Cologuard, but that reduces the amount of times that procedure needs to be done. So of course it's very safe and so much easier on the body, because there's colonoscopies have risks.
Exactly, and
besides not being very pleasant.
Besides not being very pleasant, and I'm coming up on 60, and I've never had one because I actually don't believe it's that efficacious. I mean, my physician, as you know, here in town is Dr. Jim Quacco, and we've talked about a lot of these things, and he'll tell me about certain things, and I just raise an eyebrow. Come on, Dr. Quacco. I mean, if you look at risk-benefit ratio, but if you actually looked at what I learned in epidemiology was called the positive predictive value of a test, and you probably know too that mammograms are not very effective.
Right,
they have a 55.55 positive predictive value, which means that they're only valid about 50% of the time.
Right.
If you got on an airplane that had a wheel come off every other time it landed, you would never fly that airline. And people look at medical tests.
If only half my clients did well, I wouldn't be in business.
Exactly. It's so. And I remember, and I was actually reading some stuff last night about your things, and I was looking at some work in vitamin C and some things. I got a couple websites, and there's a very interesting quote that Linus Pauling said. He said, people in medicine expect very strong evidence for alternative procedures like his vitamin C, but he says, but they'll take very weak procedures when they're looking at their own stuff, because they went after him with his vitamin C therapy. They said, oh, it's not any good because our research says. He says, but your research isn't any good. So they found very weak evidence just to support their own stuff, and I see this in medicine. and that's a complete another episode. We could have a 2-hour episode on medicine. But what I'm trying to do in our talk right now is to make this comparative analysis between what you do, because I've been interested in and I like the word hydrocolon therapy. I've been interested in it a long time, but in my mind, I had to sort, like I say, it washes away all the cells. All your probiotics are gone. I mean, you got this empty shell in there. You think about that, because logically one would think if you have a forceful amount of water, and I've seen it done on television. I actually probably have seen one of your episodes on some things. But again, I need to, in my mind, sort of figure out. And the best way to do it is to compare it with what doctors are doing. Doctors don't really do anything for colon health these days.
Not to really support or, to make sure that we don't actually have problems with our colons. And yet, as you know, I mean, our gut is the source of all of our health. So if we take care of our gut, and that really begins with the colon. It's a really gentle, safe, comfortable procedure.
How long does it take?
It takes about 45 minutes.
45 minutes.
And it's very comfortable, and people feel amazing after, because of course, what do we produce in our gut? Serotonin.
Right.
So that's stimulated. So people, I mean, sometimes they feel euphoric after, and they have they have connections with their mind and body that they just didn't have before.
I'm going to go off track a little bit here. Are there any insurance companies that are looking at this as a sort of deterrent to cancer or a preventive measure for anything? Leaky gut syndrome, irritable bowel syndrome, inflammatory bowel syndrome, et cetera, et cetera, et cetera. All of these diseases which cost billions of dollars in therapies. And you have a preventive measure here. Are any of the insurance companies kind of looking at this, like acupuncture?
All my European clients, all of their insurance covers my work, even when they're here in the United States.
Oh, really?
It will cover colon therapy and lymphatic therapy. I give them a receipt; they're reimbursed.
Wow. Okay. So, I mean, I'm driving here tonight. I'm listening to NPR, and they're talking about the decimation of Obamacare this week. And I just raised my brows and I said, only in America. Okay. All roads lead to the gut. You said, I'm quoting you on that. You also said that a person should get hydrocolon therapy maybe 3 to 6 times a year. Is there a protocol? Is there a standardization thing? Or is it as individual as holistic health should be?
Well, it's because it's, I really predict that in, a decade and maybe less, colon hydrotherapy is going to be as common as washing our hands or getting a sauna, because maybe because of the amount of young people I see who are awake about colon health, and it's just, doing a cleanse a couple times a year is just part of their regime, and dealing with our environment as it is, and they're extremely aware of that. I mean, our World Health statistics are that, half our population will get cancer, half will have diabetes. I mean, these aren't good statistics. So just cleansing and detoxing just becomes part of everybody's sense of what it takes, just like working out. I mean, you don't work out just like once and then you're done. It's a kind of a regular thing, but it just becomes something that I really believe is going to be part of everyone's lifestyle, so that we can stay as healthy as we can in the environment that we're in.
And I also watched 60 Minutes last night about the plastic, invading every beach around the world, and it can be very frustrating. But I look at what's happening. I work with a company up in Solvang that's doing hyperbaric therapies for PTSD, for certain types of chronic medical conditions, and they're doing some really good work. I also work with a group in Arizona that's doing a combination of EECP compression therapy, New Calm, cellular regeneration therapy, and hypobaric therapy. And their first research paper that was published in June essentially, without saying so, cured Alzheimer's disease. So and they're never going to say that, but that's essentially what they took people who were diagnosed with Alzheimer's, put them on a 3-month protocol, and all of these people are driving their cars now through Phoenix, Arizona,
that's
which,
fantastic.
if you don't know Phoenix, is like there's a lot of places to go there, and I'm seeing that these kind of things are happening, and I'm saying to myself, I've been in sports medicine 30 years, and like this, there's some interesting things happening. So
There are.
you were on the forefront. You've been doing this how many years now?
35.
35 years. So you've also written a couple books. So that I'm going to start asking you about these now.
Okay.
Which one came first? The
Dare to Detox.
Okay, so Dare to Detox, and we're going to go to, I think, maybe this one here. We're going to go right here. So this is Dare to, and when did this come out?
In 2012.
Okay, so it's
Yeah.
about 6 years old. Still the first edition.
Yeah.
And this is basically a book that any consumer, they can buy, they can learn
Yeah.
about gut health. I see you've got recipes in here.
Yeah.
You talk about all the physiology. You've got a flow chart and everything here. Foods to maybe you should take, maybe things that you can combine, things that you can avoid, etc. Because it's not just about getting your, if you're Elvis Presley, maybe he could afford it to come see you, but he still ate cheeseburgers,
Yeah.
3 times a day. So it's not, it's like cigarettes. It's like,
Yeah.
well, I jog so I can smoke. Well, you can, but and I actually know people that do that. They smoke and they exercise, so they figure that, All right, so the second book here is...
The second book I wrote,
Takes
It Takes
Guts to Be Happy.
a 21-day plan to heal your belly and recharge your life. I wrote that book because after people read the first book, they said, okay, this makes sense. It was my story, and it was, my program, and they said, okay, I see where you're going, but I really need a step-by-step, hold my hand through the process. So this is really a textbook. It has
Day by day,
the 21-day cleanse, which is a simple cleanse of organic fruits, vegetables, and proteins. And it has stories in it of my clients who've had life-threatening diseases that have healed. And
Excellent.
It's their own first-person stories.
Excellent. Fantastic. So you've got 2 books, and hopefully they're selling very well. But part of the issue that I brought up a couple minutes ago was, well, do you flush things out? And so you actually have a happy gut cleanse formula. Now, is this for people who go through your colon hydrotherapy?
I wanted to create it for anyone. I mean, obviously, when people come to me, one of the problems they have is I am not going to the bathroom, which should happen every day,
Yes.
right? And I have clients whose doctors will say that, well, the once a week that you go is normal, but we know it's not.
Really?
Yes, really. So I wanted to create something that was not a laxative, but a very gentle herbal formula that just naturally encouraged regularity and was healthy and was a liver detox. So that's so it doesn't, you don't have to come to me to
Right, you
buy
can buy
it or
it, you can
take it.
buy
You
this
just
at the
go
health
on
food
my
store,
website.
right, or your website.
On my website, and it's very gentle, it's very safe, it doesn't cause gas or bloating or any of those super uncomfortable
And Michael's going to
things.
put Michael's going to put your website on here. But does this work by helping with water? Does it sort of take, extracellular water and bring it into the gut to help sort of move the peristalsis along? What's the...
Why does it work? Well,
Yeah.
the things in it like slippery elm and aloe, those are herbs that have been used for a long time they just have natural properties that move things gently through the gut.
Right, okay, that makes sense when you said aloe vera.
Yes.
So the next one here is an enzyme energy. So this is digestive support.
It's digestive enzyme, right?
Okay, so this is helping. Again, they don't have to come to see you.
No, they don't have to
personally,
come to see
but
me.
Do you recommend these in combination?
Well, I mean, everybody needs to be taking food enzymes because we're just not digesting our food.
Right.
Our stress levels are so high, even good stress levels. Even the young people I see, they're just not digesting. I mean, science has shown us that people over 40 are not making digestive enzymes in their stomach. So what does that mean? The food sits there, it rots, it ferments, we have acid reflux. Weight gain, slow metabolism, people feel terrible, they're exhausted after they eat, they just want to take a nap after they eat. So taking a simple digestive enzyme like Enzyme Energy will help the food move through the body, actually get assimilated and eliminated, and then people's energy just goes right up. Sometimes just doing that one thing will make a world of change for people.
Excellent. All right, so you've got books, you've got products, You have your on-site. How many people work for you or with you in your life?
It's just me.
Just you, still
Yeah.
after 35 years?
Yeah,
you haven't franchised? We got to talk about your brand.
Thank you.
You know, the woman who was on last time with her toothpaste, she works
Yeah.
at the Santa Barbara Wellness Professionals, and you know, they have like a co-op building, but again, she's the same thing. She works by herself all day. She's you know, so that the people come in. So anyway. So I found out an interesting thing when we spoke before the show that you used to work with Dr. Henry Hahn here, you know, years back, who you know, passed away here a couple years ago, and probably was considered by the holistic health community in Santa Barbara as the #1 guy. Tell me a little bit about your work with him.
He was the preeminent, you know, alternative medical doctor in Santa Barbara. All the traditional medical doctors respected him, so he shared clients with all the medical doctors and the oncologists. He worked in all the, you know, with very serious people with very serious illnesses. And one of the things that was special for me about Dr. Hahn is because colon hydrotherapy is something that's not really a traditional Chinese procedure.
Right.
But when he started seeing how well my clients did, we began to share clients until we shared most of our clients. He was really that open-minded, and he was an extraordinary doctor, and because of him I got to work with people who were very seriously ill, and that was to, you know, to be able to alleviate not only their symptoms but really with Dr. Hahn make, you know, shift their prognosis completely.
And to me, there's a level of what I call proof of concept in the research field, is that you can take something, but you first sort of have to prove. I mean, if you have a bunch of healthy people that come see you, athletes, celebrities, whatever,
Yeah.
they have access to lots of different types of health care, and you know, they got their traveling massage therapist. But if you've got someone who's a stage 3 or stage 4 cancer
That's right,
patient,
which Dr. Hahn did,
who comes to see you,
Yeah.
and 6 months later they have no remnants of cancer in any of their marker tumors, that speaks pretty highly of what you're doing.
Yeah,
Yeah.
and I'm always part of a team when people come to me with an illness like that.
So you cross-refer to other health
I
professionals
do,
in
I
town.
do.
How many people do you see on average a day?
You know, I'll usually see about 5 to 6 people a day.
Okay, so it's a full day with your
It's a
startup
full
and
day.
cleanup procedures.
Yeah.
Well, we're coming to the end here, and I really think that what we're talking about will lend itself to phase 2. So Michael's put all of your stuff on screen. Look how fast the time
know.
went. I mean, it's
It
here
went
we are.
by
We're
in a
all the way to
second,
the
right?
end. And I really appreciate you coming on. Julia Loggins, julialoggins.com. And your clinic in Santa Barbara is, tell us within the next 20 seconds here, the location here in town.
211 East Anapamu.
Anapamu. All right, well listen, on behalf of Med Health Fit, I appreciate you coming
you.
in, and thank you, the audience, for joining us here on Med Health Fit. We'll see you next time.